Welcome to our informative presentation on erythemas. Today, we will delve into the fascinating world of different types of erythemas, exploring their unique characteristics, including morphology, associations, and distribution patterns. Let's begin with Erythema Nodosum, a condition characterized by the presence of painful, tender, red nodules beneath the skin. It is often associated with various factors such as infections, inflammatory bowel disease, and certain medications. Typically, Erythema nodosum manifests on the shins, making it a distinct clinical presentation. Next, we have Erythema Multiformi, known for its distinct target-like lesions adorned with concentric rings. This type of erythema is frequently linked to infections, such as the herpes simplex virus, as well as certain medications. The distribution of Erythema Multiformi varies, adding to the intrigue of this condition. Moving on, we encounter Erythema Migrans, a visually striking erythema characterized by an expanding red rash with a bullseye appearance. This particular type is primarily associated with the early stage of Lyme disease, caused by the infection of Borrelia burgdorferi. Erythema migrans typically manifests at the site of a tick bite, aiding in its identification and diagnosis. Shifting our focus to Erythema Infectiosum, often referred to as the fifth disease, we observe a distinctive, slapped cheek appearance accompanied by a bright red rash. Parvovirus B19 infection is commonly associated with this erythema. Initially, the rash appears on the cheeks and may subsequently spread to other body parts, adding to its characteristic progression. Another intriguing type is Erythema marginatum, which presents as pink or red raised rings with a clear center. Rheumatic fever, complication of streptococcal throat infection, is frequently associated with this erythema. Erythema marginatum tends to manifest on the trunk and limbs, allowing for its recognition and differentiation from other erythemas. Lastly, we have Erythema AB Igna, displaying a unique reticular or mottled erythema pattern. This type is often seen in individuals exposed to chronic heat from sources like hot water bottles or heating pads. The erythema is localized to the areas exposed to heat, most commonly observed on the lower legs or thighs. In summary, our exploration covered several erythemas, including Erythema nodosum, Erythema multiforme, Erythema migrans, Erythema infectiosum, Erythema marginatum, and Erythema AB Igna. Each type presents with distinct features, aiding in their identification and diagnosis. Thank you for joining us today.